Good day, everyone. We will start the whole semester with this introduction to the course. What we'll be discussing for this short segment would be the mindset needed to become successful in hurdling this course, the main textbooks that you need to read and study, and other helpful resources. Now, musculoskeletal rehabilitation means that you have to understand the musculoskeletal system. And just by showing you this very simple diagram of, let's say, for example, the shoulder, you can see so many structures here. You even have a structure called the bursa, which we'll discuss. And just by looking at this simple diagram, you can see there's so many different structures interacting around a particular joint, all of which could be a source of the patient's problem. And you have to be intimately knowledgeable of their purpose, their location, and their symptoms in order for you to be able to successfully treat the problem. Now look at this. That was the very simple diagram. Look at the shoulder. I mean, it's a very complicated, multi-layered structure. Um, you have to review everything that you need to know, and not just to memorize or to learn facts. You have to integrate all of them in order for you to become a successful physical therapist. Now, going jumping on that, I have to remind all of you that a physical therapist, his greatest asset is his mind. A physical therapist does not simply memorize facts. Of course, he knows the body, he knows the facts about the body, about the muscles, the bones, and everything else. But he or she has to integrate all of this in order to see or find out the problem of the patient and to create exercises or treatment protocols or treatment therapeutic exercises or treatment regimens in order to treat the problem of the patient. You cannot do this just by simply following certain protocols by the letter. Each patient is different. Each personality is different. Each problem is different. Each setting is different. So you have to take all of these in, and you have to realize that your greatest asset is your mind. So as we study here, don't look at it as studying for the sake of learning and passing the course. Look at it as investment. The more you study, the more you learn, the more things get inside your mind, or the more you understand things, the better your future in the career of physical therapy. Now look at this. If you understand how treatment should be, you could even adapt whatever is available in your grasp or in the patient's house in order to facilitate or encourage the patient to exercise. And so I bring to you this creative process, and this is actually the process of learning as well. Um, if you look at it, it's not very simple reading alone or memorizing alone. The first is you you identify what seems to be the problem. You saturate your mind with information or context That is, in your case, you read, you listen, you watch, you talk with others, and then the second part is incubation, meaning not only do you read about things, you also give yourself time to think about those things. It's not enough that you just simply read. You rest, you think about things. You think about what you've read. Sometimes if you have friends, you talk about them, you talk about the problem or what you've learned with your friends until you've come to the illumination, which means it's the aha moment when things finally snap together in place. Now these three, especially here, the middle three, saturate, incubate, illuminate, those are the three important things that you need to go through. Of course, validation is simply checking if what you've learned is correct or what you've learned is enough. And in your setting, you could validate this by return demos or quizzes or whatever have you. You learn some exercise, you use it on your relative, it worked, the pain went away, that's good. Okay, recommended textbooks. You have your usual rehab med text, your Bradom and also Levan. They're general. Each chapter or each section discusses cases comprehensively. Well, not really that comprehensively, but it's okay. Now, for MSK, musculoskeletal rehab, I highly recommend MAGI, orthopedic physical assessment. This is a very, very important resource if you want to be an expert on musculoskeletal conditions. Number one, once you graduate, you will realize that the major bulk of your patients will either be musculoskeletal or neurologic. This book is a very comprehensive book. It will teach you, most importantly, how to assess. This is very important because in order for you to think or to come up with a problem, you need to assess. You need to know what the problem of the patient is in the first place. If your assessment is wrong, then your problem list is wrong because you're trying to solve the wrong question. And of course, the other one would be your therapeutic exercises by Kisner and Colby. It teaches both the basic therapeutic exercises and it also has sections dealing with specific exercises on specific regions of the body. Even just the pictures alone, once you know the principles, even just by looking at the pictures alone, would be very helpful already. Now, what do we really need to ace or to get the best out of this course for this semester? Number one, you have to know the anatomy. Anatomy is very important. You have to know where things are. If a certain part of the shoulder is tender to the touch, you have to know what structure is in there that causes the tenderness. Neuroanatomy simply is reviewing your manual muscle testing, your sensory testing, your reflexes, etc. You also need your basic healthcare skills like patient positioning, transfers, basic hygiene, personal protection, physical agents. Also, very important. Why? You now have to apply heat, cold, and what else? Ultrasound, laser. So you have to know when do you apply heat and why do you apply heat. when do you apply cold, and the reason why you apply cold. The rationale or the processes that occur when you apply heat or cold is very important. Okay, so we will be discussing musculoskeletal cases by region, and we will also be discussing diagnostic imaging. This would be the basic X-ray views. We might touch up on MRI or CT scan or ultrasound. Ultrasound, not so much, but the other two we will. And we'll be discussing different treatment options as well. Okay, we've come to the last part, and I've reserved this last part as this is actually our unofficial department motto. The only easy day was yesterday. This is not to strike fear into your hearts, knowing or dreading what comes tomorrow, but it is to give you a fighting spirit that whatever challenge we will face in the coming months, we will always be resilient enough to meet it. And it's true. I mean, I have been a physical therapy student just like you in the third year. And I can say that although during this time you might think that this is one of the hardest that you have encountered, I'm confident to say that once you've graduated and once you've worked as a physical therapist professionally, you would say that the student life, your time as students was one of those times that was really carefree. And I can say that for myself. When I graduated from PT, I went to medical school. I realized that my PT years was actually very, very easy, very carefree. Once I graduated from med school and went into residency, I realized that med school, although it was not easy, but compared to residency, it was a cakewalk. And after residency comes your private practice. And all I can say is, looking back, residency was actually not so bad at all. So life is a continuing challenge. And what you think is very hard right now, someday you'll look back and see that it's not so bad at all. So I hope I've given you some things to ponder on, and I really hope I've challenged you to work hard. Actually, if you think about learning all these facts as a preparation to treat your patients, it's not going to be so bad or so boring. So I'll see you again in the upcoming lectures. Thank you.